Hey everyone, my name is Leah Vennard and I'm one of the occupational therapists here at Integrity Rehab. I just wanted to say thanks for watching this video about occupational therapy as we celebrate OT month. So a question I get asked a lot is, what is occupational therapy? And the easiest way to describe that is we help people of all ages and stages get back to the activities that they need to do and that they want to do in order to perform their activities of daily living. So we view life in terms of occupation, and it's not just the job you go to, it's the roles you have. So for example, I'm a therapist, a wife, a daughter, community member, church member, the list goes on and on. And we believe that engagement in these roles is what allows us to have a meaningful life. Therefore, since the beginning of occupational therapy, when there has been a disruption in these roles, we believe that it creates frustration, anxiety, and chaos in your daily activities and your daily life, and that's why we want to get you back to these activities as quickly as possible. When you come in and you see us in the clinic, you see such a small role of what occupational therapy is. So for example, you may be given some exercises to rehab a fractured wrist, but what you don't see is us racking our brains over 20 practice models and frames of reference to work into that plan of care. We are constantly thinking about your plan of care and your treatment options to increase your independence in those activities and to get you back to what you want to be able to do. Because of the way that we view occupation, the way that we view life, I believe that occupational therapists have a very unique opportunity in this COVID-19 crisis. So we understand the frustration that comes with losing or having to change roles that you have had. So we wanted to offer you a little bit of encouragement and give you some ideas. So one thing that I've been telling people is, if you miss the role of being a friend or a family member, pick up the phone, call your family members, write them cards, write them emails. I love when I'm walking out in my neighborhood, because you can still go outside if you're social distancing. The doodles and illustrations that are left behind in chalk, so you can get kids involved in that way. You can leave plates of goodies, of cookies with a handwritten note of encouragement, something that Integrity has been doing. In addition to staying open and getting creative about how we're treating our patients, we've been collecting pantry staples to give to senior citizens and homebound citizens that we know of, just to let them know that we care. What my church has done is they're collecting food as well, but we've also written cards to the widows in our community saying, we see you, we care about you, and we want to be there for you in any way that we can. There's plenty of opportunities to serve at food kitchens or food pantries if you're missing out on that. We encourage you to get creative. So we know that it's discouraging to not be able to do what you normally have done, but we encourage you to think like an occupational therapist and say, okay, I missed this role. What activities can I do to adapt it so that I can do that role seemingly well? And then how can I kind of incorporate other things to help develop that role? We at Integrity are here to help you if you need us. In addition to seeing patients in the clinic, we are seeing patients in their homes through telehealth. We are still doing our home health. So just like we have had to get creative to be there for our community, we want to encourage you guys to do the same. Let us know if you have any questions. We are here to serve you. Thanks. Bye.